It's not gonna, oh, there we go.
Hello, world. It's Dr. Reiter from Bentley Animal Hospital. Our first go live on Facebook. So we're going to do tonight, we're going to talk about Dental Awareness Month. That's what it is, February. So we're going to talk a little bit about dental care, how to care for teeth on both dogs and cats.
Okay, we'll wait a minute and see if we get any.
We're going to wait a couple minutes just to wait for people to join. So
one person on.
There will be question and answers, most likely probably better for after the presentation, and then I can go back and respond to whatever they have to ask. So we'll have a couple of pets. Gibson and Rocky will be helping out tonight.
Betty Scott says hi.
Hello, Betty.
Okay. I think let's go ahead and start, and then maybe we'll get more, because it'll be recorded. So. Okay.
Cat too.
15 minutes.
Okay.
Okay. Go ahead.
So to begin with dental awareness, let's just talk about animals like cats and dogs. They also have gums, teeth, the same needs that humans do. So it's very important that we take care of them, and we can do things as a preventative maintenance. We don't like to pull teeth anymore in veterinary medicine. We used to never even do dental cleanings, or what I call oral procedures now. Instead, we do preventative medicine, so we can treat the gums, treat the teeth, and prevent removing teeth down the road. But that's the thing that we have all had to change. Even I have had to change, If I can change, we never did any dentals whenever I was in vet school, but now I do anywhere from 6 to 10 a week. So it's a very important thing for both the patients and for veterinary medicine in general, and to give them long life, So three things. So three things you can do as an owner. The best thing to do is brushing the teeth. That is the number one thing you can do to prevent plaque buildup. Now, if your pet has a bunch of, cat or dog has a bunch of plaque on their teeth already, you can't brush that off. Just like a human, you have to go to your dentist, you have to get that cleaned off. So then brushing, or these other things we're going to talk about, can really help out. So brushing is number one. Number two is using a water additive. This is a product that you can add to the water. It's got to be fresh water every day. And it has an antibiotic in it, and that's how it works. So every time they take a drink, they flush their mouth with an antibiotic. We all know that plaque is built by bacteria. So if you're using an antibiotic that when they drink their water, then that's going to help fight. And that lasts 24 hours. So, and there's mixing instructions on the back of most of them. So you want to make sure that there's one. I use Trisdent. It's made by Dermazoo. There's other products out there that I have used that have an antibiotic. So something that has an antibiotic, that's what you need to use. The next thing to use would be some kind of chew. Now I choose a product called CET Chews. It's Hextra because it also has chlorhexidine, which is an antibiotic. Made by Verbac. It has on the outer surface impregnated an antibiotic. So when they chew the chew, they are also using that antibiotic the last 24 hours to help fight the bacteria that produces the plaque. So that's what my dog Gibson, who you're going to see in a little bit, that's what I use. So, but like I said, brushing is the number one. Now I'm going to get a couple of patients up here, and we're going to show you how to brush the teeth. So let's bring Gibson up first. Okay, so brushing the teeth, you're going to have a toothbrush. Hey, no treats. Open that for me. as I ripped the toothbrush out of the package because it was not prepared to get out. So we have a dual-ended toothbrush. This is for the little dogs. You can cut these, make them smaller. I'm going to use the big one on Gibson. So the most important spot on the tooth when you're brushing their teeth are the sides. You do not have to worry about getting inside their mouth. On the inside, what we call the tongue side or the lingual side of the tooth. So the most important spots are going to be the front of the teeth, top and bottom, and the sides. Now you can see he's got a little bit back here. These large teeth have usually the most tartar, but you can brush these without even the mouth being open. You can actually take a toothbrush and brush along the sides like this. Now my dog is very good at this. I understand that, and other people will fight, but if they fight you, you can hold it closed like this and you can literally brush with their gums closed. Same as the fronts, just doing the tops along the sides. Just like this. So you do not have to open the mouth and get in here. I could on my dog, but most people can't. We understand that. There's toothpaste. So that they have that is poultry flavored, or it'll have mint flavored. There's all kinds of different ones.
Do not use human toothpaste.
So yes, do not use your human toothpaste, because if your dog does swallow it or your cat swallow it, they are going to vomit. So they make specific toothpaste that they can swallow. We all know they're going to swallow it and go down. So, and they won't vomit it up. So you don't have to have the toothpaste, but it, you know, it helps. And if you got a new patient that you're starting out, your new pet, cat or dog, you can actually put the toothpaste on your finger. Let them lick it off. Don't just come cramming this stuff in their mouth, because you're going to scare them. So you can start them out by just putting a little bit and letting them lick off your finger, or putting it on your finger and rubbing. We do that with the puppies. And then we eventually get to the point where you take it to a brush, so you can slowly build them up. So that's how brushing of the teeth works on a patient. I'm going to get Rocky up here. We'll see how Rocky does. So thank you, Gibson. Okay. You may have to stay here and help hold. I don't know how Rocky's gonna do with this. Hey, little Rocky. So Rocky is going to be a perfect patient for us to show you guys what plaque and tartar buildup is. So we looked at Rocky this afternoon, and this, if you look at these teeth, is a lot of plaque buildup. Swollen gums, red gums. The gums are bleeding when I rub on them. So these are the areas I told you to concentrate on our webinar here, to brush these areas. The fronts aren't so bad, you know, but his teeth, he has a lot of odor in his mouth, but that's all from the bacteria, odor producing bacteria. This is all removable. We can make this all white again. It's doable, but we have to do it soon so we don't get permanent damage. So, and making sure we don't have loose teeth. So this dog's the same way. You can start out with your finger by just rubbing. So it's the same as the big dog, same way. And Rocky's being very good about this. Good job, Rocky. You know, so he has never been on film before. Well, I have Rocky, so. But the same way, I would probably use a smaller toothbrush with Rocky and just use it to brush his teeth. So I'll slide it in the gap here, and I can actually brush his teeth like that. I can even, Rocky has let me even open his gum. I don't want to brush too hard on him, because he's going to bleed because of his tartar built up. But we're going to take care of him pretty soon to get it all cleaned up. And then we'll educate the owners on just how to take care of it, just like we're talking about today. So, thank you, Rocky. Lauren, give me a cat. Yeah. So, we're going to get a cat out and try that. We'll see how that works. So, spray some alcohol on the end of that. A few other things we have while we're waiting. So we do have some smaller chews for the smaller dogs. So we have different sizes of the chews with the antibiotics, all in the same, you know, different packages. Make sure you get the right size. They do make a dental health diet. Purina makes one. There's other manufacturers that do have the same. The way these dental diets work is when you bite into the kernel is hard. It lets the tooth sink into it, and it kind of shaves the plaque off. That's how these diets work, no matter what one you're buying. So also, they do make finger brushes that come with toothpaste. I prefer a larger brush, but you know, finger brush some people like better, so use a finger brush. Oravet, made by Marielle, your same producers of Harcourt and Frontline. They make a product that works as a sealer. When they chew this chew, the sealer gets on the teeth, and it basically works as a wicking machine to let the plaque slide off easier, the bacteria and plaque slide off. Again, this product will not work if you got tartar on the teeth now. So you got to get them cleaned. If the dog had bad breath and you see a lot of tartar or there's bleeding or swollen gums, they need it taken care of now. So get it done by a veterinary dentistry. You know, I'm not really a veterinary dentist. I'm a veterinarian that kind of specializes in dentistry. So, but get them cleaned, then you can go to these things. A few things they do make some chews for cats. You know, and they're kind of a little bit more finickier, but they do have chews for cats too. This has fish flavor in it. I've used it for years. Some of them really love it. So, Veggie Dents would be something, you know, I'll use that. If they will not do any of these others, I'll go to this product. I don't think it works as good, but I keep it because, you know, it gives everybody some kind of option for their pet. Okay, who are we bringing up here? Muffin? Muffin doesn't know it, but Muffin's going to help us out too. So now cats are the same way. The same idea. Brush on the sides and the front. That's the main place to focus. So, and cat's teeth are the same way. And Muffin probably is not going to like this, but you can actually see Muffin. If you look at that tooth there, I don't know if you can appreciate it, but it's very red, very swollen gum. Muffin needs to have the teeth done also. Now Muffin also is missing quite a bit of teeth. If you look down below here, there is no teeth at all there. So they have been removed by me because cats do get quite a bit of dental issues that need to be addressed. You can see there's quite a few more on this side. So, but cats are the same way. All you have to do is hit the outside, guys. So, and the fronts also. So this one's missing some, but mainly the backs, but also hit the fronts, spend more time on the sides. Thank you, Muffin. So, I'll probably take some questions now, and I can go over more dental stuff if we want to on the just doing dentistry. I guess the most important thing I can tell people listening to this, if you are going to have a oral procedure performed in your pet, you know, the most important thing is safety. You know, like I tell my clients, the most important thing of any dental is to have a live animal at the end of it. So, and if that means spending a little bit of extra money to put a catheter in them, to do fluids, you know, we have fluid, we have actually warmers for the pets to keep them warm during the dentistry, during the dental. We also have fluid warmers. Everything helps to keep them alive. That's the most important thing. I can do all the other work. I can fix them out, but I gotta have time and I gotta have the right stuff. And it takes not just me, but we have 3 people working on every pet. We have a technician doing the procedure, a doctor overseeing it, looking at X-rays. We do X-rays on every dental. Very, very important. And if your veterinarian ain't doing X-rays, find one that does. So that's the best thing I can tell you, because there's a lot of stuff below the gums you will not see with your naked eye. So, and we do all those things.
So Betty Scott wants to know, how old is a dog when they generally get their first teeth cleaning?
It all depends, Betty Scott, on the breed of the dog. So some Shih Tzus I do every 6 months because they need dental that often. My dog Gibson that you guys saw earlier, we started him at 8 years of age. So Goldens, Labs, those type of breeds are going to be later. It depends on what they chew on, and it depends on their genetics. But little dogs, like I was telling Rocky's owner, if they got facial hair, they tend to have a lot more buildup. Greyhounds and Whippets almost need it every year. You know, like I said, some Shih Tzus I have to do every 6 months, some Shih Tzus once a year. But it all depends on the buildup. And everybody wants to know, if I clean my dog's teeth, Doc, when do I got to do the next dental? And you know what I tell them? I'll see you in 6 months, because I'm very anal about looking at the mouth, and I'll tell you then, every dog's a little bit different. But certain breeds, it'll be 2 years of age. If it's a small breed dog, it could be 2, it could be 4, you know. So hopefully that answers your question, Betty. Any other questions you guys may have, I'm here for whatever you guys need.
2 minutes.
So a couple other things while we're waiting, if people do have other questions. So this is the X-ray that we use, just to kind of give you an idea. We use this. It looks just like they do in humans, right? You put it on a phosphorus plate, it takes the X-ray, you put it in a machine, and it becomes digital. So all these things are digital. All these things can be sent to specialists. or whatever needs to be done. So it's very important, and we keep a log of it, a backup of everything. So all very, very, very important when it comes to doing this stuff. So because whenever I do a dental a year from now, and I want a tooth that's in question, I'll go back and look at the previous x-rays. What did that tooth look like a year ago? You know, how can that affect the decision we make? All that takes a big part. So.
One more minute.
Go a little longer?
1 more minute.
Huh?
1 more minute.
One
We got
more
about
minute?
1 more minute for questions if anybody else has
If
any
anybody
questions.
has any other questions, I can, you know, I'll just keep talking all night too. So, also very important is this machine. This is a monitoring machine that monitors their oxygen saturation, their heart rate, their temperature, their ECG, all that stuff. Their EKG in humans, right? That all gets monitored during the procedure, and that's what this machine does. So. And all this takes time, and all this, of course, takes money. And everybody wonders, well, how much does it cost? You know, so and when people tell me, you know, hey, I can go down the road and get a dental for $150 less, but you know, what's your pet's life worth? That's the best thing I can tell you. You know, and everything affects us, and you know, and we want to do everything we can to keep them alive. So, there's no more questions. Yep.
Excuse me. Tammy Haviland said she thinks she's just joining. She's missed it. Her question is about cats.
Yes. What about cats? Would you have a specific question about? They need dentals as often as their mouth tells me they need dentals, if that's what you're asking.
Okay.
So if you have bad odor or they have red gums that are swollen, then they potentially need to have their teeth cleaned. And only by looking at them, really they need to be examined well. You know, and even a bad cat, even a cat that doesn't like me or wants to bite me, I can still look at their mouth. You know, it's doable. You just got to, the veterinarian has got to be able to just adapt to the situation and deal with it. You know, that's what we do.
And John Scott wants to know if you know anything about the new Purina Dental Life Advanced Care shoes.
I do not. And I don't know how new those are, but I haven't even seen anything about it. And as a matter of fact, the Purina rep was here today. So I know they just came out with a neurological diet. And it's a new chew from Purina.
Yeah.
Yeah. I have not seen that. And I prefer the chlorhexidine, you know, if you've been listening to the other stuff, Scott, right?
John, yeah.
John, sorry. So, you know, that I prefer a chlorhexidine, a rinse, or brushing, of course, is the best. You know, I think treats are overrated anyway it comes to removing tartar. Brushing is the #1 thing. We all know that film that we feel. They call that a biofilm. That's when you wake up in the morning, you rub your tongue on your teeth and you feel that roughness. That's a biofilm. And brushing will remove that. You know, mechanical action of brushing. You cannot, and I did not add this earlier, but you have to brush at least 3 to 4 times a week or don't even bother. You know, everybody will say, well, my groomer brushes the teeth once a month. Well, imagine if you brush your teeth once a month. It's all those other days of biofilm buildup that really matter. So.
And then what about the therapy laser treatment on the mouth?
On the mouth. So I do laser therapy on the mouth for stomatitis in cats, if that's what we're talking about. I'll also use it after every single dental that I do. There's irritations at the gums because we do subgingival cleaning. So we just don't clean the tooth itself, but we get up under the tooth in that little, what they call the sulcus. So, and then after every single one we do, we'll use a laser therapy to help heal the gums, reduce the pain, and speed up the healing. But they've had talk about using it in cats with stomatitis. So, is that what it was? The question was regarding.
And how does poor dental health affect the rest of the body?
So if you know, and I talk about this every day. So if your animal has a lot of bacteria and their gums have pus under the gums and they're bleeding, that means that bacteria has access to the body system. That means you can get septic. I've had, for instance, a beagle that came to me that I looked in the mouth. The dog was slowing down. The owner just thought it was because of age. We pulled 18 teeth, put it on antibiotics, and 2 weeks later, the lady gave me the biggest hug in the world because she didn't realize how run down that dog was actually septicemia from bacteria in the blood system. That's how run down that dog out. Now it took it years to rot out 18 teeth. That dog could be 12, you know. But I have dogs that come in from breeders that are rescued by a rescue, and they'll be 8 years old and they won't have a tooth left in their mouth, and they got a heart murmur at 8. That's the effects. You know, your heart and your kidney, you know, or excuse me, your brain and your kidney get 60% of your brain output, or excuse me, of your blood output. So all that blood that circulates through there is depositing bacteria as it flows. So good question. Okay, I'm gonna wrap it up, and we'll do something here soon on something different. So thank you.